iKure is a social enterprise which is providing affordable and accessible healthcare to the last mile using technology intervention. We started our journey in 2010, and prior to that, I was working in IBM and Oracle for close to 12 years, last in Oracle as a solution architect before starting iKure. Initially, iKure's mission was to provide affordable and accessible healthcare to the last mile using technology intervention. We all know that there is a huge demand and the supply gap in the healthcare, especially in the rural healthcare space in India. For every 1,800 people, we just have one doctor. And with ever growing increase in the population, we will never be able to bridge this gap. So the only way that we can achieve in shortening this is using of effective technology. In the initial period of 2010-11, we were thinking that how we would be able to design technology, and more so in a bottom-up approach wherein we have to understand the limitations on the ground, right from the native people who are using the technology to the infrastructure limitations such as internet unavailability in these far-flung areas. We built our own cloud-hosted proprietary software called WEMS, which stands for Wireless Health Incident Monitoring System, which captures the entire flow of the patient right from the last mile to the clinics, which acts as at a congregation of the hubs, to the various hubs wherein the patients can be referred for various secondary and tertiary care. Towards the end of 2012, we understood that just technology is not good enough to create the right kind of impact. That's why we started our own rural healthcare facility with an aim to provide a one-window approach, meaning that when a patient is walking to a facility, they would be able to get a physical doctor consultation, medicines, various tests such as BP, ECG and sugar, as well as if they need any access to the secondary or the tertiary care, they can be referred to various hospitals. And slowly we were able to optimize on the healthcare delivery, and we came up with a hub and spoke model. In the period of the last 3.5 years, we have strengthened our model in many ways. Initially, when we enter a new area, we do a need assessment study, we do the disease profiling, because each area has its own demography and the limitations. There are various terrain challenges, and we have to understand the whole feasibility of that area. So once we have an understanding of that area, we start with various services such as mother and child, to eye, to GP or the general practice services, telemedicine, dental, and several others, wherein we have to design the holistic healthcare delivery. Just to give an example, we are operating in Torpa in Jharkhand. This area has 96,000 tribal population, wherein Tata Trust and Pradhan have been operating for last 15-20 years, providing women empowerment, agricultural intervention, financial inclusion. Tata Trust and Pradhan, they have been able to achieve by bringing livelihood to these very backward tribal population by asking them to grow pulses, broccoli, millets, and through these measures they were able to see financial inclusion into the community. But what was missing was, due to unavailability of healthcare, more than 50% of their savings was getting lost. More than 95% of this community suffers from malaria, and any single incident of such cases, that causes anywhere, the patients have to pay anywhere between 3,000 to 5,000 rupees. So now, in partnership with Tata Trust and Pradhan as part of TRI, or the Transforming Rural India initiative, we have set up a hub and spoke model. In the hub, which is at the center of the Torpa town, which is surrounding this block, we have the hub location, which has the physical doctors, medicines, basic tests. It has also the pathology services, eye-related services. And then there are the spokes which operates few days in a week in the far-flung deeper areas, wherein a mobile medical team goes, let's say on Mondays, morning 9 a.m. to 12 noon, wherein the patients in these communities, they are able to see physically these doctors, and in case out of that, let's say the doctor has seen around 50 patients, out of which if around 10 to 15 patients needs follow-up services, we have community health workers who would be able to act as the interface between the patients and the doctors. These community health workers are none other than the members picked up from the community, mostly the women in the age range of 20 to 45, 50 years of age. They have the smartphone loaded with our own solution and the medic bag that has various essential point of care device such as BP instrument, ECG, sugar testing equipment, hemoglobin testing device, weight machine, and of late we have partnered with Philips and we are bringing in new advanced devices such as charm that will help them to detect pneumonia in infants as well as fetal Doppler for the pregnant mothers. There are several other advanced technology integrations which we are working, which will help us empower these community health workers to capture as many vital data at the last mile and help these data transmit via cloud and make it available to the doctors who will be able to provide various kinds of services. So let's say whenever the doctor is able to get this data, the doctor has 4 things to do, like nothing to worry, change the drug, change the dosage, or bring the patient to me. Throughout this entire period, we have also understood that in the rural areas, the unavailability of doctors and medicines is not the only problem. The problem lies much deeper, wherein we have understood that there are challenges with respect to social, cultural, psychological and several other factors which is pushing back these communities in various ways. So what we have come up with is which we call as convergent innovation, wherein we have developed an ecosystem and iKure is acting as a platform wherein it partners with various NGOs such as Pradhan, foundations such as Tata Trust, Deshpande Foundation, which is able to give us access to the last mile community. They are able to do the community mobilization, access to these various members. And on top of that, we have various hospital partners such as Narayana Health, AIMS in New Delhi, Sanjeevan and others, wherein we are able to send these patients during any secondary or the tertiary care. And we have also understood that the need for the various research partners is also very crucial, wherein we would be able to find out that what are the major challenges in this area. For example, if an area, let's say wherein we have worked with McGill in Orissa, if more than 90% of the communities is suffering from anemia, these problems won't be able to be solved using just doctors and medicines alone. So what we have done is an agricultural intervention, wherein we are trying to educate these communities to grow pulses, broccoli, millets that act as the natural diet to these communities. And on top of that, we have been also working with several organizations such as Philips, Bosch, GE, which is bringing various new innovative point of care devices that will strengthen these community health workers. We have been also coming up with various sustainable designs because we at iKure understand and the importance of designing the whole model in a very sustainable fashion. We have come up with a health card, which is a digital card that has a QR code enabled, wherein once the health worker goes to the last mile, they would be able to scan these data from the mothers or the communities. Through this, they would be able to enter the entire vitals of these patients, and that gets transmitted via cloud. We have also developed a mother and child care framework in partnership with University of Michigan, wherein these health workers, once they enter various statistics of these mothers, such as whether the mother is a first-time mother, whether there was any abortion, miscarriage, or what is the anemia level of these mothers, we are able to design the high-risk cases and the scoring of the infants. For example, whether there has been any development delays in the 12 months, 14 months, 16 months and up to 24 months of these infants. Through these frameworks, we are able to design that what are the risk factors of these mothers and infants, and thereby we are able to act on a very small turnaround time. We have been also working with MIT Next Lab, and through this framework we are designing a predictive healthcare model for the year 2025, wherein we are trying to understand what is the relation between health, water, sanitation, nutrition, and how we will be able to identify these problems and come up with holistic sustainable designs that we will be able to showcase to various governments and other organizations that can help us design sustainable models for the future. In the last 6 years of our journey, we have treated more than 400,000 patients and are catering to 3.5 million population across 6 states in India. And now we are looking forward to cater to more than 10 million population in 8 states in the next 2 years. We are looking for various partners in achieving this mission. Come, be a part of this journey for a better life, for a better world. Thank you.